Welcome to April. This is Maternal and Child Health Month for Rotary International. We support training, education, and medical projects related to this area of focus. Through these initiatives, Rotary makes healthcare available to mothers and children so they can live longer and grow stronger. Rotary achieves these goals through partnerships with the Reproductive, Maternal, and Child Health Rotary Action Group and medical professionals and volunteers around the world. And it's Maternal and Child Health Month in District 7430. Did you know that about 6 million children die each year from preventable malnutrition, inadequate health care, and poor sanitation? Let's ask how we can help eliminate preventable maternal and child mortality. Let's work on prenatal clinics, cancer screenings, immunizations, and training. Our project showcase features past District Governor Ron Smith of the Bluebell Rotary Club and Deb Geiger of the Bethlehem Rotary Club. Ron will describe his several multi-club projects to enhance prenatal care in Uganda. Deb will tell us about the success of her club's Global Grant Mother's Milk Bank in India. Our showcase Tuesday on April 12th features Dr. John Townsend and Dr. Pallavi Deshpande. Dr. Townsend is the chair of the Reproductive, Maternal, and Child Health Rotary Action Group. He will inspire us with the Action Group's worldwide efforts to save women's lives. Dr. Deshpande is the lab director and clinical microbiologist at Deshpande Diagnostics. She will share why milk banks are important to infant health. She'll also tell us about 2 mothers' milk banks she's developing in India. April begins the last quarter of our Rotary year. Join in our Public Image Challenge. Participate in the District Training Assembly on April 9th. On April 22nd through 24th, be inspired at our district conference where you can network and party with Rotarians from 18 counties in New Jersey and Pennsylvania. Join us for the STEM Year fundraiser on April 30th. Grow membership and serve the environment in our Rotary Day of Service winding up on April 30th. I want to thank you personally for generously supporting Ukraine and its refugees through the Rotary Foundation, Shelter Box, and direct giving of money and supplies. See you soon.
I'm Deb Geiger with the Rotary Club of Bethlehem. Our 2013 district grant sparked our involvement in a global grant, allowing us to make a difference in maternal child health locally and internationally. Human milk is a significant source of basic nutrition as well as being vital to infant immunity and neurological development. In our community, breastfeeding for a minimum of 9 months was well below statewide and national norms, so our first goal was to provide educational support, including training of a lactation specialist, to promote an increase in breastfeeding of newborns. Our second goal was to increase awareness of accidental newborn suffocation, which occurs in many low-income households when newborns sleep in bed with parents. Depending on need, educational program attendance and completion was incentivized by offering pack and plays as a sleep option or baskets of newborn essentials to new moms registered at the Bethlehem Women, Infant, and Children's Office. The district grant allowed us to purchase audiovisual equipment and pack and plays, and our partnership with the Bethlehem Health Bureau, who acquired a state grant for educational videos and newborn supplies, enhanced our ability to meet our goals. Our interest in maternal child health led the district to invite us to work with the Pune, India Rotary Club to develop a human milk bank in a country where low birth weights and preterm babies are common. A complex project, the Pune Club established local relationships with hospitals in the community, purchased equipment, developed marketing materials, and so much more. A local hospital collects, pasteurizes, and administers the human milk. Our club foundation donations that year were committed to this extraordinary project. Approved by Rotary International in 2014, the Human Milk Bank collected over 337 milliliters of raw milk and administered 648,000 doses of pasteurized human milk by year 5. To date, over 2,600 babies have received this life-affirming service. Both of these projects relied on successful partnerships.
I'm Ron Smith from the Bluebell Rotary Club. How does a Rotarian make a difference in maternal and child health? Well, in our case, it was with $500,000 in funding from the Rotary Foundation and my Bluebell Rotary Club. At the time this project started, Bluebell Rotary Club was only 20 years old and about 30 members. It was a significant giver to the annual fund, giving $5,000 a year. And about 25% of our club funds and members were actively engaged in international projects, having done some matching grants. So I made a personal visit in 2013 to Uganda to assess the needs and opportunities in the areas of maternal and child health. In Uganda, 16 mothers die every day, while compared to the US, it's less than one. In the area of infant mortality, over 5 children die out of every 1,000 births in the US, while almost 50 die in Uganda. So certainly there is a need to improve maternal and child health care at the health centers which deliver health care in Uganda. We had to improve midwife education, skills training. We wanted to deploy distance education means to be able to sustain that training. But we also need to improve the healthcare centers, infrastructure, water, supplies, medical equipment, beds for delivery. So myself, with the support of my Bluebell Rotary Club, engaged Drexel University through my son's medical faculty advisor, Dr. Owen Montgomery, who's now with Jefferson as vice president. I was aided by my classmate Tusu. Tusu is a member of the Rotary Club Kampala North, and he connected us to Makerere University in Uganda, which is now a Rotary International Peace Center. The network in Rotary is really amazing. Along the way in the project, this network has provided the resources as needed. The network we put together, the team between Drexel University obstetrics and pediatric doctors, along with those at Makerere University and the faculty, have developed and had two-way vocational training teams. They've been aimed at developing training for the health centers aimed at midwives in Uganda. We focused on distance education that we now call remote learning. We learned to adapt to conditions on the ground with VTTs and the local health centers. Bluebell hosted and engaged a vocational training team, and with that, its annual fund giving has significantly increased over the last 8 years. We've seen how improving healthcare infrastructure and midwife training skills has really helped. We've had 3 global grants, first $80,000 and then $130,000, and then $230,000 after that, with the third one now still in progress. We've had now 4 universities in Uganda and 2 in the United States actively engaged. We've equipped them with distance education at 6 health centers that have become regional training centers for midwives, and they are connected to the internet. Well, how did this all happen? It happened with great collaboration and partnerships between Rotary districts and Rotary clubs. 4 districts contributed their district-designated funds, and 10 Rotary clubs with cash and annual fund contributions have really made a difference in replacing the district-designated funds over time. Of course, patience, perseverance, flexibility, and adaptability have been very important. The adaptability is key during COVID because we're able to pivot and provide personal protection for midwives in these health centers. And finally, and most importantly, it's through the generosity of Rotarians of the Rotary Club of Bluebell in our District 7430 and throughout the world that are really contributing annually to our Rotary Foundation annual fund that have been able to allow us to do such good in the world. How do you make a difference? Take your vision to your club and engage them. Thank you.